Good evening, everyone. How's everybody doing?
Okay.
My name is Catherine Tavares, and I'm going to explain to you how to be a nurse anesthetist. A nurse anesthetist is a nurse that specializes in anesthesia. Anesthesia is medication that keeps the patient pain-free and comfortable during surgery. There are 4 prominent nurse anesthetists. The first one is Catherine Lawrence, and she provided anesthesia to the wounded soldiers during the Civil War between 1861 and 1865. She provided anesthesia to the soldiers due to the fact that there was not enough doctors to provide anesthesia, which there was many more nurses to help out too. The second prominent nurse anesthetist is Sister Mary Bernard, and she was the first person with the title of a nurse anesthetist. The third prominent nurse is Alice McGraw, and she was recognized for her many achievements and accomplishments throughout the field of nursing. She was the first nurse to provide the open drop inhalation technique of anesthesia. It's a technique that is inhaled to keep the body pain-free and numb. It's a combination of ether and chloroform. The fourth prominent nurse is Agnes McGee, and she opened up the first school in 1909 for nurse anesthetists. The program was a 6-month program. Compared to the programs today, they are 24 to 36-month programs. There are currently 7 programs in the state of Ohio. The 2 closest to Canton are the University of Akron and Case Western Reserve in Cleveland. The requirements for Akron University is you must have your bachelor's degree in nursing, obtain your RN license, 1 year experience in advanced critical care. You must pass a GRE exam, maintain a GPA of 3.0, be certified in ACLS and PALS, and that is Advanced Cardiac Life Support and Pediatric Advanced Life Support. You must shadow a certified registered nurse anesthetist for at least 8 hours and do an interview to be accepted into the program and do a 600 word paper acceptance letter. The program is 27 months with a 24 residency. A nurse anesthetist is very important and play a critical role during surgery. She does the initial body assessment along with mental to make sure that the person is stable enough to go through surgery and get the right anesthesia. The next one is the anesthesia plan to see that if the anesthesia needs to be generalized, localized, or if they need a sedation. The next one is to stay with the patient throughout the whole surgery until they go down to a step-down unit. During the emergency, the nurse has to be prepared to critically think to make sure that she is prepared to provide life support to the patient if an emergency arises. There are many opportunities for a nurse anesthetist. They can work in the military, in doctor's office, or in hospitals. A nurse anesthetist, according to the American Association of Nurse Anesthetists, there are currently about 4,400 certified registered nurse anesthetists in the United States. The annual salary for a nurse anesthetist is between $145,000 and $170,000. The state of Ohio starts their nurse anesthetists off at approximately $160,000. In November 2001, nurse anesthetist is able to practice without a physician or anesthesiologist. There are only 16 states that have passed this law, and Ohio is not one of them. Anesthesia is 50 times more safer now than it was 20 years ago due to the expansion of technology, pharmacology, provider education, and practicing standards. The improvements with anesthesia have proved tremendously. I am currently attending Stark State College and will be transferring to Akron University to pursue my master's degree in nurse anesthetist. Hopefully I have gave you a better understanding of what a nurse anesthetist does, and thank you for coming out.